Good day, everyone. Our last lesson for physiotherapy in gerontology, lesson 11, physiotherapy and geriatric pharmacology. For introductions, physiotherapists working with any patient population, especially the older adults or the older persons, must be aware of the drug regimen used in each patient. We must have a basic understanding of the benefits and the adverse effects of each medications and must be cognizant of how specific drugs can interact with various rehab procedures, especially for older adults, because they are more sensitive to adverse effects of drug therapy, and many adverse drug reactions can impede the patient's progress and ability to participate in rehabilitation procedures. Therefore, adequate knowledge of geriatric pharmacology can help physiotherapists recognize and deal with these adverse effects, as well as capitalize on the benefits of drug therapy in your patients. So, after completing this lesson, you should be able to define polypharmacy, discuss how older persons compare drugs and physiotherapies or physiotherapy, discuss the reasons and factors that contribute to adverse drug reactions in older adults, identify factors that may contribute to errors in prescribing drugs for older persons, discuss reasons why older persons have problems with compliance for taking medications, identify drugs that may give problems in conjunctions with physiotherapist work, and discuss the role of physiotherapists in dealing with patients who presents with polypharmacy and ADR. Okay, so these are the contents of the lecture. We'll start with understanding about polypharmacy, and we will look at some case studies. So before we proceed, let's read together to have a bit of overview of a situation of older persons where they may require polypharmacy. So, Mrs. Jones, a 98 years old woman with Parkinson's disease who recently had an amputation above the knee, came to physical therapy late one day. Her therapist was busy in the gym with several other patients, but she handed Mrs. Jones a black dumbbell weight, which Mrs. Jones had frequently used to do her warm-up exercise. Instead of beginning her usual exercises, Mrs. Jones raised the dumbbell to her ear and said, "Hello, Emily." She continued to chat about what she thought was a fawn. The therapist immediately went to the nurse's station and discovered that Mrs. Jones was on a new medication, which had obviously profoundly confused her. Her medication was changed, and in a few days, she was her usual coherent self. This real-life example graphically depicts one of the many complications of administering drugs to older persons. Okay, now let's begin. About two-thirds older persons are on regular medications. People aged 65 and above account for about one-third of all prescriptions written. However, we need to understand that taking polypharmacy or taking multiple medications can have or is associated with adverse effects, drug-drug interactions, duplications of drug therapy. Older persons may have poor adherence because of some physiology of changes in the physical and mental functions of the older persons. The cost may limit the adherence or the ability to buy medications, and they may have, when they present with adverse drug reactions due to polypharmacy, they may have decreased quality of life. So what is polypharmacy? Polypharmacy is a concurrent use of multiple medications. The current definitions, okay, you may try to look for the what it means by multiple medications. Okay, the recent definition is taking 5 or more medications. So these are normally common among older adults above 65, which is the major populations that taking polypharmacy. Why? Why? Because of old age is normally associated with many disorders, chronic diseases, and also geriatric syndromes. And they consume about 30% of all prescriptions. And also buying from the or getting their drugs or over the counter. Okay, they go to the pharmacy and they just buy their medication. So polypharmacy is also can be referred to as an excessive use of drugs, and that may lead to overdosage of drugs. So the doctor's more likely to prescribe medications for older clients than young ones. Why? Because, yeah, like I mentioned earlier, because of probably because of their chronic diseases, which is very much associated with age, and the presentations of geriatric syndromes. Okay, so they may have altered response to medications because of the cumulative effect on physiology of normal aging. Alright, so the interactions between old age, disease, stress, and trauma may present with altered response to medication. Elderly rely on various medications to control or relieve a range of age-related problems like cardiovascular disease, diabetes, degenerative joint disease that they normally present with pain, autoimmune disorders, and various symptoms of geriatric syndromes. So we need to understand that polypharmacy may have many risks, okay, because of medication errors, wrong drug timing, or wrong entry route. The adverse effects from each drug, okay, may be the primary reasons for polypharmacy could be the primary reason for adverse reactions. And if they are taking many drugs, polypharmacy, okay, there are interactions between the drugs. So, physiotherapists dealing with older persons or maybe other populations have limited knowledge and little formal training in pharmacology, yet they frequently advise clients on the use of OTC medications and administer these in the course of. So now let's discuss. Older people require special consideration where medication is concerned, as many receive multiple medications for concurrent conditions. Okay, so we understand that older people, based on our experience, normally they come to us with multiple problems. They have multiple diseases. They have probably non-communicable diseases, and they may have other problems. And nowadays with symptoms of post-COVID infections, right, so they may complain all sort of problems, so they rely on polypharmacy. So this practice of polypharmacy increases the risk of drug interactions as well as adverse reactions, and also affecting compliance. Okay, so for example, when they take more polypharmacy and they develop reactions, okay, so they may stop taking the drugs, and of course this might not help them in their recovery process. So how older persons compare drugs and physiotherapists? Because normally they see the doctor maybe once in a month, once in a few months or few weeks, but they normally come and see physiotherapists daily or twice a week or 3 times a week or once a week. So older people are more likely to prefer physical means than medications to feel better. So older persons or older people want advice from physiotherapists on everything, including they tend to ask us, they bring their drugs and see us and ask us about the drugs. Okay, but this could be good or bad. Why? Because elderly distrust medications they don't understand. There are too many medications prescribed for them, they get confused. They are afraid of choking on medications. The physicians are always changing and rushing them. For the elderly, physiotherapy or physical therapy provides social interaction as well as healthcare. They enjoy being with healthy, fun therapists. Elderly trust personal contact like hands-on approach. The nurturing approach, encouragement, and humor relationship with the physiotherapist. Side effects of the medications often make them feel worse, disoriented, sleepy, weak, stomach ulcer, hearing impairment, and you name it. For the elderly, medication risk is greater and benefit is less than in the younger people. In contrast, physiotherapy has little risk and definite benefits in both the old and the young. Okay, so for instance, in older persons, if they have impaired organ functions, okay, they may have multiple diseases, okay, and then because of that they have altered drug concentrations, and this again interact with the altered organ functions. And older people with multiple disease, they are given multiple drugs, polypharmacy or drug administration, and yet they have altered compliance. And because of changes or impaired organ functions such as the heart, kidney, liver, and thyroid, they have decreased homeostatic regulations, and all these interact or all these contribute to the adverse drug reactions. So as a physiotherapist, there are a few reasons that could relate to our understanding on why older persons may have poor compliance for taking medications. That we can actually have some interventions or advice on how to deal with these reasons. Okay, so they may have problems with opening pill containers because of weakness, muscle weakness. They're not able to, hold the cap and twist it because of very weak fingers and hands. They have pain, arthritic pain. They have tremors, and they tend to spill when they have these problems. Okay, so older persons also may have fear of choking while swallowing large pills. So in the next time when they're supposed to take medication, so they refuse to take the medication. They may have problems reading the labels or informations. If they read, they may misinterpret because of inability to really look clearly at the informations in the labels. They may have depressions. They are sleepy. They have poor concept of time for doses, and because of this, sometimes they just miss their timing for taking medication. They may have cognitive impairment that they cannot recall a few moments ago that they have taken the medication. And now again they take a double dose of the medications that will increase the risk of adverse effect. The cost of medications are prohibitive for some older patients, and they normally choose food over the medications. Okay, so because of the presence of adverse drug reactions that limit the benefits of medications, okay, the ADR may limit the effects, the benefits of the medications, or they may not take the medication at all because of the adverse drug reaction. So the bottom line is that we will never be sure whether they are taking too much or too little. Okay, so elderly are more likely to tell the physiotherapist than the doctor whether they are taking medications or not, because they are too polite to tell the doctor that his pills make them feel sicker, and you are in a position to make a difference. So what are the problems with medications that affect the physiotherapist's work? Okay, so some of the ADR, okay, it may cause deafness, okay, and we know that older person, one of the physiology, the normal no, changes due to aging is hearing loss. Okay, so when they have hearing loss, they have problem communicating. Okay, so when in during rehab, they may not be able to participate, or they couldn't hear what is the instructions given by the physiotherapist. And they may have visual impairment. They are not able to see clearly the demonstration by the physiotherapist. They may be drowsy, or they have poor mental status. They couldn't remember instructions given. They have balance impairment. They tend to faint. They feel like fainting. They have poor muscle strength. Okay, they have poor exercise tolerance or cardiovascular tolerance. Okay, they may have respiratory ability because of oxygenations. They may have abdominal discomfort that really stop them from doing any interventions given by the physiotherapist. They may have joint pain, limited range of motions, or pain that limits their ability to move. They may have bruising and skin rashes, skin thinning, cracking, bleeding that may need to stop the physiotherapist for a certain durations because of fear of worsening the conditions. Okay, so these are some of the examples of the medications that may cause dizziness, fainting, and weakness. Okay, so normally they present with inner ear disturbances, nausea, low blood pressure, anemia and hypoxia, electrolyte imbalances like hypokalemia, dehydrations. Okay, so normally they are taking antihypertensive medications, anti-anginal therapy, certain anti-rheumatic drugs that cause anemia, for example, NSAIDs, cytotoxic drugs or agents, drugs that cause drowsiness and loss of mental acuity, for instance, antihistamines, pain medications, muscle relaxants, anti-nauseants, some beta blockers like propranolol. Okay, drugs that cause insomnia. Okay, for instance, like caffeine, aminophylline, albuterol. Okay, examples of drugs that can cause abdominal discomfort. Okay, when they have abdominal discomfort, normally they complain of constipations or inability to void the bladder completely, stomach and gastric ulcers, and inflamed bowel disease. Okay, so these are the examples of drugs that normally can is or associated with abdominal discomfort, pain medications, anti-muscarinic agents, NSAIDs, cytotoxic agent for chemotherapy, antibiotics. Okay, so drugs that induce muscle wasting, catabolism, anorexia and cachexia. Okay, so these are the examples: glucocorticoid steroids, beta-2 agonists, beta blockers, digoxin, diuretics, angiotensin, bromocriptine, methylphenidate, chemotherapy. Okay, drugs that may cause joint pain and disturbance in the range of motions. All right, for instance, the beta blockers, betazolol, pindolol, cholesterol lowering agents, clozapine, danazol, trolosifen, rifampin, losartan, and calcium channel blocker. Okay, so now we have come to the conclusion. It is pertinent that physiotherapists understands that adverse effects of drug is very common among older persons, such as knowing the type and effects of the medications might promise success in rehabilitations. For example, when to emulate the patient, teach exercise or mobilizing, as when a patient is under the influence of drug, they might not be able to understand the instructions given by a physiotherapist. So it is very important, okay, working with doctors, pharmacists, and nurses that may improve the cost effectiveness in the rehabilitation strategies. Okay, if you notice that the patients that normally come to you uh, and now they come back to you with a change in their behavior, change in their attitude, change in their level of awareness, or probably you suspect that it could be because of the adverse effects of drugs, and you may want to discuss with the doctors or the pharmacists on the types of drugs that they are taking, or if they really take certain drugs that influence their drugs that cause the adverse effects, okay, and it interferes with your rehabilitation regimen. You may want to discuss with the doctors or pharmacists on how to go about with the timing of the medications, okay, in terms of when to take the medication, or maybe you can discuss about the dosage of the medication so that when they come back to you for rehabilitations, they are in a good conditions, and they can actually benefits from the rehabilitation. Okay, so physiotherapists must be aware of the drug regimen used in the older patients and how the benefits and how it probably cause adverse effects of each medications that can affect the rehabilitation strategies or the planning, the treatment planning of older clients, right? So physiotherapists also must play an important role in recognizing ADRs in older adults. So therefore, they must have some knowledge about geriatric pharmacology. Okay, and finally, physiotherapists can help encourage proper adherence to drug therapy and discourage the excessive and inappropriate use of unnecessary medications in the older patients. Okay, so if you notice that they may present with ADR, okay, if you do not know what to do, please refer them back to the doctor or discuss among the multidisciplines. Alright, so having completed listening to my lecture, alright, and of course, 80% of understanding geriatric pharmacology comes from the students themselves. They have to read and read and read, okay, trying to understand the interactions between polypharmacy and rehabilitation process, because we need to understand that certain drugs also can benefit, can enhance the effects of rehabilitations. Okay, so these are the terms that you should at least understand or know, so that when you are discussing with the other disciplines, you know the stuff. Okay, so drugs, polypharmacy, pharmacokinetics, over-the-counter drugs, adverse drug reactions, diuretics, antacids, tranquilizers, anticoagulants, benzodiazepines, diazepines, analgesics, antibiotics, anti-inflammatories, antispasmodic, vitamins. Okay, so these are the review questions continued from the previous one. You describe attitude of the elderly towards physiotherapy and medications. Okay, so how do you think, okay, your experience, how do the elderlies discuss, or maybe they inquire about medications, or whether they said that they prefer physiotherapists than the medications. What are the common drugs that may lead to polypharmacy in elderly? It is good to know, okay, the common drugs that are commonly given to older persons, okay, and that we should note down, because sometimes it, most of the time, or maybe sometimes it interferes with our rehabilitations. Okay, why the elderly prone to practice polypharmacy? Okay, we already discussed this. They may have they have chronic diseases, they have geriatric syndrome, they have all sort of complaints. Explain the physiological factors that may contribute to adverse drug reactions in elderly patients. Okay, there are many physiological factors. For instance, like, if they present with chronic diseases, they may have impaired organs, okay, and they have the heart, the kidney, the liver, they altered functions. Okay, the kidney may have altered function in uh, removing any excess of toxics, excess of drugs, okay, that reduce the ability to do these functions, and also plus multiple chronic disease. All this can lead to adverse drug reactions. Okay, and discuss the medical problems that affect physiotherapist intervention for older persons. Okay, we already discussed this. For instance, like they have drowsiness, weakness, fainting, hearing problems, they have probably vision problems. Okay, number 8, identify drugs that cause complications in the elderly. Also, we already give some examples of these medications. Okay, so it is for physiotherapists, okay, it is important for us to know the group of the drugs, okay, the family names of the drugs. An elderly patient complaining of feeling sleepy after taking medication early in the morning. At the same time, you want the patient to perform some mobility exercise. As a physiotherapist, discuss how you would handle this situation. This is a very common situation when normally a physiotherapist, they if the patient, this is just an example, based on experience, my experience, and also of course we learn in the books, right? um, you come in the morning, you see the patients. Yesterday the patient was really they enjoy talking to you, they really active during the rehab. Okay, and this morning when you come and see them, They are complaining of sleepy, after taking medications early in the morning. Alright, but because you already planned that the patient should be able to progress, okay, but then you think that is because of the medication. So how do you handle this situation? Okay, so how can you advise a patient who is on OTC polypharmacy? Alright, discuss whether it is ethical for physiotherapists to prescribe medication drugs to their clients. Okay, is it ethical? No, 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 no. Okay, so discuss. Let's look at some case study. Alright, Mr. Abu, a 72-year-old man, is taking more than 4 types of medications. His problem is that he can't remember which medications to take when, so he ends up taking them all at bedtime. Remember, he is a man who undergoes a typical aging. Well, at this age, 72-year-old, he requires medications to control his multiple health problems. Being an older person who undergoes typical aging, making his body's ability for pharmacokinetic changes, so he is more vulnerable to adverse effects and drug interactions, affecting the therapeutic effects of medications that he is supposed to gain. Looking back at Mr. Abu, he has several impairments such as vision loss, cognitive dysfunctions, and musculoskeletal. In terms of other factors, such, for instance, sociocultural, these may contribute to his inability or unwillingness to follow prescribed medication. Could be loss of family, friends, and income. Because of economic factors, he may have to choose between food and medications. So he ends up with OTCs instead of expensive doctor visits, use of outdated medication, use of home remedies, share medication, and nutritional status that may affect how the body metabolizes medications. So what do you think about this case? What can you do to change the situation? Do you have any roles? None? If yes, how? Okay, some of the and thank you very much.